Kensington, a neighborhood in Philadelphia, is grappling with a devastating opioid crisis. Open-air drug markets are commonplace. People use drugs openly on the streets. This public display of suffering is a distressing sight for residents. Families are fearful for their children. The crisis has a stranglehold on the community.
The emergence of xylazine, known as Tranq, has intensified the crisis. This powerful veterinary tranquilizer, often mixed with fentanyl, has flooded the streets. Tranq's effects are devastating. Users experience horrific skin lesions and a heightened risk of overdose. The situation in Kensington is dire. It is a stark reminder of the human cost of the opioid epidemic. The neighborhood is crying out for help. Xylazine, or Tranq, is a potent veterinary sedative. It is not intended for human use. However, it has infiltrated the drug supply in Kensington and other parts of the US. Tranq is often mixed with fentanyl, creating a deadly cocktail. The effects of Tranq are particularly harrowing. It causes severe skin ulcers and abscesses. These wounds can become infected and, in some cases, lead to amputation. Tranq also exacerbates the respiratory depression caused by fentanyl, significantly increasing the risk of a fatal overdose. The emergence of Tranq has added a terrifying new dimension to the opioid crisis. It is a potent reminder of the ever-evolving nature of drug use and the urgent need for effective harm reduction strategies. Amidst the despair, a glimmer of hope has emerged, offering a much-needed respite to a city long plagued by the opioid crisis. Philadelphia has recently seen its first decline in drug overdose deaths in 5 years, a significant milestone for the community. In 2023, 1,122 lives were lost to overdoses, down from 1,207 in 2022. This reduction, though modest, represents a crucial turning point. This decline suggests that efforts to combat the crisis might be gaining traction, thanks to the relentless work of community health workers and public health officials.
However, this news must be met with cautious optimism. The battle against drug addiction is far from over, and the community must remain vigilant. Overdose deaths remain tragically high, particularly among Black residents. Disparities in access to healthcare and harm reduction services continue to plague marginalized communities, highlighting the need for equitable solutions.
The decline in overdose deaths is a step in the right direction, a beacon of hope in a long and arduous journey. Yet the crisis is far from over. Continued and intensified efforts are needed to address the root causes of addiction and provide support to those who need it most. The community's resilience and dedication will be crucial in overcoming this ongoing challenge. The drug supply in Kensington is heavily contaminated. Fentanyl, a potent synthetic opioid, has permeated the streets. To make matters worse, xylazine is now frequently mixed with fentanyl. This lethal combination is driving the increase in overdose deaths and exacerbating the already dire situation. Fentanyl is incredibly potent. Even a minuscule amount can be fatal. Xylazine intensifies fentanyl's effects, increasing the risk of respiratory depression and death. The presence of these substances in the drug supply makes it incredibly dangerous for people who use drugs. The contamination of the drug supply is a public health emergency. It requires immediate and comprehensive action to prevent further loss of life.
Drug checking programs offer a vital tool in the fight against the opioid crisis. These initiatives are designed to provide immediate and practical solutions to a growing public health emergency. These programs allow people who use drugs to have their substances tested for the presence of fentanyl, xylazine, and other harmful adulterants. This service is often provided free of charge and can be accessed at various community events and health centers.
This knowledge empowers individuals to make informed decisions about their drug use. By knowing exactly what is in their substances, users can take steps to reduce their risk of overdose and other health complications.
Drug checking programs can be life-saving. They provide a critical layer of safety for individuals who might otherwise be unaware of the dangers lurking in their drugs. Knowing that a substance contains fentanyl or xylazine may lead individuals to use smaller amounts, use in the presence of someone who can administer naloxone, or avoid using altogether. This proactive approach can significantly reduce the number of fatal overdoses.
These programs provide crucial information that can prevent overdoses and save lives. They also serve as a bridge to other health services, offering support and resources to those in need.
By providing accurate and timely information about the content of street drugs, drug checking programs can play a crucial role in reducing harm and connecting people to support services. They help build trust within the community and encourage safer practices. They are an essential component of a comprehensive harm reduction approach. By integrating these services into broader public health strategies, we can make significant strides in addressing the opioid crisis and improving community health.
To maximize the effectiveness of drug checking programs, careful consideration must be given to their implementation. Anonymity is paramount. People who use drugs must feel confident that accessing these services will not result in legal repercussions.
Data collection should be minimized. Only essential information necessary for public health purposes should be gathered. Collaboration with harm reduction organizations is crucial. These organizations have established trust within the community and can connect individuals to vital support services.
By prioritizing anonymity, minimizing data collection, and collaborating with trusted organizations, drug checking programs can provide a safe and effective means for people who use drugs to make informed decisions and reduce their risk of harm. Despite the immense challenges, there are seeds of hope in Kensington. The community is coming together in remarkable ways, showcasing resilience and determination. Community organizations and government agencies are working tirelessly to address the opioid crisis. Their collaborative efforts are essential in creating a support network for those in need. These efforts, while often underfunded and overlooked, are making a tangible difference in the lives of those affected by addiction. The impact can be seen in the improved well-being of individuals and the overall community.
Harm reduction organizations like Prevention Point Philadelphia provide a lifeline to people who use drugs. Their work is crucial in preventing overdoses and offering much-needed support. They offer a range of services, including needle exchange, overdose prevention education, and access to naloxone. These services are vital in reducing harm and saving lives. Government funding has also been allocated to support housing initiatives, addiction treatment programs, and community development projects. These initiatives aim to provide stability and long-term solutions. These efforts are a testament to the resilience of the human spirit. The community's ability to overcome adversity and support one another is truly inspiring. Even in the face of immense adversity, individuals and organizations are coming together to support those in need and create a brighter future for Kensington. Their dedication and hard work are paving the way for a more hopeful tomorrow.
The opioid crisis in Kensington is a complex and multifaceted problem that demands a compassionate and multifaceted response. It is not enough to simply address the symptoms of addiction. We must also address the root causes, such as poverty, trauma, and lack of access to healthcare.
We need to shift our focus from punishment to treatment. This means expanding access to evidence-based addiction treatment programs, including medication-assisted treatment. We must also challenge the stigma associated with addiction. People who use drugs are not criminals. They are human beings deserving of our compassion and support. The road to recovery is long and arduous, but by working together, we can create a future where everyone has the opportunity to heal and thrive.
The opioid crisis is not confined to Kensington. It is a national emergency that demands a coordinated national response. The federal government must take a leadership role in addressing this crisis. Increased funding for addiction treatment, harm reduction services, and public health initiatives is essential. We must also address the pharmaceutical industry's role in fueling this epidemic. Holding pharmaceutical companies accountable for their actions is crucial to preventing future harm. The opioid crisis is a complex problem that requires a comprehensive solution. By working together, we can create a future where everyone has the opportunity to live a healthy and fulfilling life, free from the grip of addiction.